we have complications of hepatitis. Okay, with the liver itself, five complications we can remember. So relapsing hepatitis, cholestatic hepatitis, fulminant hepatitis, chronic hepatitis, and hepatocellular carcinoma. Okay, relapsing, cholestatic, fulminant, chronic, and hepatocellular carcinoma. Hepatocellular carcinoma is common with hepatitis B and C, more common with B. Okay, chronic hepatitis, hepatitis B and C are there. D co-infection will be there, but obviously C is more common. Fulminant hepatitis is seen with almost everything except except A. Okay, fulminant hepatitis is seen with B, C, D, and E, but D is very important. And then E is also important, okay. And then moving on to cholestatic hepatitis. Cholestatic hepatitis now, especially it occurs in pregnancy, so hepatitis E. And the relapsing hepatitis is biochemical and serological relapse is seen. It is the only thing which is seen in A, and only A is seen in relapsing hepatitis, okay. Okay, அது மட்டும்தான் with the liver. And then with the big toppa. With the big toppa is nothing but ascites. And then with the blood vessel, shit in the blood vessel, which is coagulopathy. And then with the liver munjichu, so spleen. Spleen la vandu hypersplenism. And then two things with the serum. So it can be like a serum sickness like syndrome, which is associated with hepatitis B and essential mixed cryoglobulinemia with C. Okay. Serum sickness is B, cryoglobulinemia is C. Okay, and then with the vasculitis, two vasculitis are seen, polyarthritis nodosa and leukocytoclastic vasculitis. So polyarthritis nodosa is seen with hepatitis B, and leukocytoclastic vasculitis is there. It is otherwise characterized by purpuric cutaneous lesions. Purpuric means purple color, cutaneous means skin, lesions is just like some sort of lesion. And for the joint, there will be arthritis, and for the pancreas, there is pancreatitis. For the heart, there is myocarditis. For lung, there is atypical pneumonia. For RBC, there is aplastic anemia. For the central nervous system, there is transverse myelitis. For the peripheral nervous system, there is peripheral neuropathy. So, like every single organ is going to be affected. That's what I want to say, okay? And then the weird syndrome, which we already saw in the previous video. Guillain-Barré syndrome in children, hepatitis B presents without jaundice, with a rash, but it's not itchy. Okay, the rash is on the face, on the buttocks, and on the limbs, and there will be lymphadenopathy. So it's called papular acrodermatitis of childhood. Okay, moving on to the other concepts about complications of hepatitis. Gallstone is not a complication. Focal segmental glomerulosclerosis is not a complication. So like pancreatitis can happen, but then gallstones are not happening. Kidney is mostly not involved. But like we can expect glomerulonephritis to occur, immune complex glomerulonephritis. MGN, that is membranous glomerulonephritis, occurs in case of children. MPGN, membranoproliferative glomerulonephritis, is occurring in adult, but FSGS is not happening at all. Okay, so these are all the complications of hepatitis B. Moving on to serial monitoring. Serial monitoring, okay, indicates HBsAg does not reappear, so it indicates that the patient is in early phase of infection. So we don't give any therapy because 99% is going to be self-limiting. Okay. Indications of antiviral therapy in case of chronic hepatitis B. No treatment is indicated for asymptomatic patients. No treatment is needed for non-replicative HB carriers. If they are undetectable HBeAg with a normal ALT and HPV DNA less than 10 power 4 copies per ml documented serially over time, then we don't have to give. So we don't have to give it for number one, asymptomatic. Number two, non-replicative people. Non-replicative people la vandu first one is undetectable HBeAg, normal liver function tests such as normal ALT levels, and third vandu the last one, HBV DNA is less than 10 power 4 copies per ml. Okay, so antiviral therapy is not indicated for these patients. So like antiviral therapy is indicated with for patients with active HBV replication. For example, if the DNA copies are going to be more than 10 power 5 per ml with ALT which is very high and detectable amount of probably HBeAg and those who are symptomatic. Okay, so yeah, thank you.